We've had so many discussions about treatments. We've talked about hydroxychloroquine, and that became a political football. Ivermectin now is getting, battles and everything taking place. But, as we talk about it, is there a treatment out there that anybody likes? And would you believe in a treatment if, say, it was recommended by, I don't know, Health and Human Services? Well, how about this ad?
I'm Dr. Rachel Levine, Assistant Secretary for Health. It is critical to have safe and effective treatments to help people avoid the worst effects of COVID-19. COVID-19 monoclonal antibody treatments have received an A rating by the National Institutes of Health Treatment Guidelines Panel based on evidence in reducing the risk of progression to severe disease and hospitalization for high-risk COVID-19 patients. If your patient tests positive for COVID-19, please have a conversation as early as possible to discuss monoclonal antibody treatment. The treatment must be given within 10 days of symptom onset. Patient eligibility for monoclonal antibody treatment was recently expanded, giving healthcare providers more latitude in exercising clinical judgment. And the treatment is now available as both an intravenous infusion as well as a subcutaneous injection. Together, we can beat this. Please learn more at combatcovid.hhs.gov.
Now, normally I am sort of living in what's almost like opposite day. If the FDA or CDC, or in this case, Dr. Rachel Levine, who is Assistant Secretary over at Health and Human Services, is recommending monoclonal antibodies, I tend to think maybe I just want to avoid those. But as it happens, just yesterday I was talking to Dr. Richard Bartlett, who let me know he's working in a clinic delivering monoclonal antibodies as we speak. And so to get to the bottom of this, obviously someone I trust is Dr. Richard Bartlett. He's joining me now live from that clinic. I know we're dragging you out in the middle. You've got patients coming in as we speak. But tell me about monoclonal antibodies, and do they work? And what are you seeing when you're using them on patients?
Dell, this is Regeneron monoclonal antibodies. The company that makes it is Regeneron. Okay. And that's what President Trump received. That's what other heads of state received a year ago. I wish I would have had it available sooner, but gratefully it's here in West Texas now. And here's what we're seeing. It's a 30-minute infusion, and monoclonal antibodies is not new technology. It's not something that Bill Gates cooked up just the other day. Okay. This is something that's real science. And what I'm seeing is people in 30 minutes, they sit in a chair, it's very boring, they're getting an IV, and their chest pain's going away, their chest tightness is going away, their back pain's stopping, their headache stops. They've had a headache for 5 days nonstop, and it goes away during the 30 minutes. We're seeing tremendous results.
Yeah, okay. What is a monoclonal antibody? What does that mean?
So it's from your white blood cells, your B lymphocytes make antibodies. And this is from one line of antibodies, and they purify it. Antibodies are like a lock and key. They only match with one antigen. And this one's made for the virus. And so we're seeing these dramatic results. This is not new technology. They've used monoclonal antibodies for up to 40 years now. And I'm seeing boots on the ground, front line, that this is saving lives. Otherwise, I wouldn't be dressed like a marshmallow in this outfit, running from room to room, surrounded by COVID patients.
Is this, when we talk about, is this the same as convalescent plasma? Does this come from a human being that's recovered, or is this manufactured in a plant somewhere?
Originally, this... I'm not a part of creating it, but this is an antibody that's it's not plasma. Plasma has all kinds of proteins and a great risk. This doesn't have a risk of infection like plasma does. And so this is a purified antibody product, and so this is amazing.
And does it have similar issues? Now that we're into the Delta variant, my concern would be that if these antibodies were designed for, say, Alpha or Beta variant, the original strain, is it affected by that, or does it see the whole virus and therefore it's handling many different parts of the virus? What is your thought on
Well,
that?
the bottom line is I'm seeing great results, and
Okay.
we've seen articles that it can prevent over 70% of hospitalizations and deaths. This is a game changer. There are other things that we talked about that have been proven to be effective by Oxford University. There are other things that make this is the best of the last years put to this disease. And
Okay.
so this is not mutually exclusive with anything else. It's a one and done 30-minute infusion, then you're watched for 30 minutes thereafter. And so we're seeing radical improvement in just 30 minutes. And really the only risk is possible allergic reaction. Anaphylaxis would be the worst of that.
Okay.
We have not seen that so far. And so we're very cautious and prepared, but this is something that they've set up clinics all over Texas, all over the United States. These clinics are popping up, and this is a game changer when you add that with the other strategies that are effective.
Well, it's interesting. Texas is taking this approach in order to keep the ICUs from getting overrun. Governor Abbott is sort of promoting these clinics all over the state, which is an interesting approach. I know Ron DeSantis is speaking a lot about monoclonal antibodies. Now, of course, we originally brought you on because you were one of the ones out there in the forefront saying budesonide, an inhaled steroid, could be used as a part of a treatment protocol. Is this something that you would say replaces those other treatments that other doctors are using, or do you do it in addition to?
In addition to, no doubt, Dell, it's all hands on deck when you're dealing with this. And these are not mutually exclusive. This is a 30-minute infusion that can, they say some monoclonal antibody infusions can decrease hospitalization and death by 78%. I like 100%. And
Yeah.
so Oxford University talked about budesonide in the STOIC trial, a randomized controlled trial saying 90% of hospitalizations could be prevented with inhaled budesonide. But you also have other tools available. And of note, one of the things that I saw at the NIH database is that one report said 14.1% of hospitalized COVID patients have venous thromboemboli, clotting. And so an aspirin a day has been a part of my protocol from the beginning, that you can't look at. And also what puts people in the hospital is secondary bacteria. And so you got to be proactive on that with empiric antibiotics.
Okay.
And some people need some supplemental oxygen at home. And whatever you can do to keep them out of the hospital, out of the ICU, and from a tragedy.
What point would you take this product? Obviously, it's once you're infected, it's not a preventative, right? It's something you take once you realize you've tested positive?
So this is all about early treatment, and that's what has been ignored, suppressed, minimized, censored, is early effective outpatient treatment. And so this falls in that category, and all of the people that were anti-early treatment agree that this works. I think that means that there's early effective outpatient treatment. And the bottom line is that's winning strategy is. And so we need to, I appreciate you sounding an alarm, letting people know that this is a effective treatment tool. There's other strategies that work. People, there's doctors on both sides of mask and no mask, vaccine, non-vaccine. You know where I stand on all that.
Yeah.
But everybody agrees on monoclonal antibodies.
All right, excellent. So in finally sort of talking about it, I know a lot of people are looking for treatments. This is one that's available. You've been just buried. So many people reaching out. I keep sending people to you. Is there a website now that you recommend for people that are looking for treatments? Maybe they're in a state where the doctors aren't responding or aren't giving out the types of treatments that they're looking for. Where should we send people now that are trying to get good advice and in that forward-thinking space of using all the things that we're seeing work all around the world?
So they can look up, call the local hospital and ask where the local monoclonal antibody infusion center is.
Okay.
That's a start. Also, I know one telemedicine service that's using my protocol directly, and that's synergyhealthdpc.com. And you have to scroll down on choices to COVID urgent within 24-hour care, so you get cut in line and you're not waiting 3 days.
Okay.
Also, if you go to budesonideworks.com, it's overwhelmed, but they have a system at the Synergy Health, and so that seems to be getting people to get taking pretty quick. Of course, a step in the way of the patient and their personal doctor, so that's a place to start. But that's not a place to stop if they say they don't have anything for you but Tylenol. So you need to be on the things that Oxford has proved, that every doctor agrees on: monoclonal antibodies, budesonide, aspirin. Ivermectin is a powerful tool that's been proven by many doctors, and then an antibiotic called clarithromycin. But I would start with your family doctor. Take care of you, then seek more help.
Do you have one more minute? I'm not sure if you have a patient. You've got to go.
Yeah.
All right. So can I have you watch something? Because last week you bring up ivermectin. There was a real attack by the FDA. They've come out against ivermectin. It was all over the news. Just take a look at this, and I just want to sort of ask you a question about it.
Words of warning. Earlier this week, the Department of Health reiterated its warning against the use of a drug called ivermectin.
A new false cure for COVID in high demand, ivermectin.
Be aware that ivermectin has not been proven as a way to prevent or treat COVID-19.
Rumors circulating on social media about its use specifically for COVID-19 in India. That is not based in reality or fact.
The FDA, the NIH, the World Health Organization, and academic institutions across the world, not just the U.S., are not recommending ivermectin for COVID management.
With doctors unwilling to prescribe it for COVID, people have rushed to farm supply stores, buying and taking large doses meant to deworm livestock.
Some Tractor Supply stores even posting these signs alerting people that the ivermectin dewormers and injectables they carry for animals have not been approved by the FDA for people and could result in injury or death.
This story blows my mind because you've got some anti-vaxxers who are unwilling to take an FDA-approved vaccine that millions of people have taken at this point, by the way. But at the same time, they are willing to put a horse deworming medicine in their bodies.
What would you tell someone who is considering taking that drug?
There's no clinical evidence that indicates that this works.
Obviously, huge spin on this. They're referring to it now as horse paste, deworming pills, and why should humans take it? Joe Rogan, who is a famous podcaster around the world, has just gotten COVID. Our hearts go out to you, Joe, but being accused of taking a horse deworming pill, but it sounds like he's doing great. I don't know that you've ever sent anyone down to the Tractor Supply to grab some horse paste and eat it. But what do you think of, when you see that and you see Fauci saying there's no evidence that ivermectin works, what do you have to say about that thought?
Okay, so there's an old saying, if his lips are moving, blank. I heard the same thing about budesonide. He said that he had an interview with Matthew McConaughey on the internet.
Yeah.
And he said to Matthew that budesonide is just a placebo, Matthew. It doesn't really work.
Is there any downside to there are people that are believe that budesonide and taking zinc is working? Is there any downside to doing it?
There's a placebo effect to make you feel better and less anxious, but in reality, Matthew, it doesn't have any effect. Right.
Okay.
Oxford University said the opposite. Oxford's the oldest university in the English-speaking world since 1096, 72 Nobel Prize laureates. They say that he's wrong. They say that 90% of hospitalizations, urgent care visits, and, you know, what has he said that's right? And so this is more of the same pattern of information going out from two different sources. One has been proven wrong over and over. I'll say that half of the people that I'm seeing in this infusion center have been vaccinated. I love people. I have loved ones that have been vaccinated, others that haven't. The problem is the virus, and the problem is there's a tremendous effort to censor information and interfere with science and facts. And, you know, if you have a source like Oxford University in the trial, and Fauci talking about facts and science, he just says something and has nothing to back it up.
Look, we've seen the studies. We've shown them here on the show. Studies so powerful with ivermectin that they discontinued them because people were dying that were in the placebo group, and they just couldn't watch it any longer. So it's amazing to watch the FDA, the CDC, Health and Human Services that are supposed to be caring about people, sticking with what apparently is mostly the protocol around the country is, you know, go home, wait till your oxygen level drops so low that you're in critical condition, come back, we'll drug you and put you on a ventilator where you have a 1 in 10 chance of dying. It's really nice to see here in Texas that they are moving into different treatments and continuing to pursue treatments, not just vaccinations. Obviously, we're going to have to use everything we can as we get through this. Do you see an end in sight? I mean, is there a surge, I guess is my question. We're in Texas. I feel like now, more than ever before, I know more people that are coming down with COVID. I know more people that are, you know, having a rough time. I don't know anyone that's died yet, but it does feel like, whereas last year I was like, I don't even know if this virus exists. This year I definitely feel like something's going on. Is there a surge going on from your perspective on the front line?
You know, January 30th in Texas, we pretty much hit a flat line for 4 months and beat COVID. And then all of a sudden something new appeared. Where did SARS-2 come from, Del?
Yeah.
And so it be something that comes from the same place. I've talked to a general, I've talked to a colonel, I've talked to congressmen about this. And so I'm saying we got to think outside the box here and look at the obvious. The SARS-2 came from a specific source, came from a lab as far as I can tell.
Right.
And so, I want people to think outside the box here. We were told by Fauci this is just a variant. Really? Based on what? I'm seeing that we have SARS-2 didn't just come from bat soup, apparently.
Right. Well, as those conversations change, it does start to make us question what is the purpose, where did it come from, whether then it was on purpose or on accident should be a much bigger conversation than it is in the middle of this, yet it seems to be avoided by all mainstream media that simply wants to tell us to avoid horse deworming paste. Look, I know you're taking time away. I am so thankful to have you out there. Thank you for bringing clarity. In this case, the FDA is recommending monoclonal antibodies, and it sounds like it's working right before your eyes. So for people out there, we all want to thank you for continuing to just bring the facts as you see them and not getting caught up in any politicization of any of these discussions. Real lives are at stake, and it's just great to know that you're brave enough to be out there on the front lines doing your job and telling the truth about it.
Del, I count you a good friend. I thank you for what you do.
All right, thank you. Take care and get back to those patients. We love you.
If you like that clip, then be sure to check out our live broadcast of The High Wire every Thursday morning at 11 a.m. Pacific Time. You can watch it on iTunes and Twitter. We'll see you there.